Herpes simplex viruses, more commonly known as herpes, are categorized into two types: herpes type 1 HSV-1, or oral herpes, and herpes type 2 HSV-2, or genital herpes. Most commonly, herpes type 1 causes sores around the mouth and lips, sometimes called fever blisters or cold sores. HSV-1 can cause genital herpes, but most cases of genital herpes are caused by herpes type 2. In HSV-2, the infected person may have sores around the genitals or rectum. Although HSV-2 sores may occur in other locations, these sores usually are found below the waist. What causes herpes infections and outbreaks? Herpes simplex type 1, which is transmitted through oral secretions or sores on the skin, can be spread through kissing or sharing objects such as toothbrushes or eating utensils. In general, a person can only get herpes type 2 infection during sexual contact with someone who has a genital HSV-2 infection. It is important to know that both HSV-1 and HSV-2 can be spread even if sores are not present. Pregnant women with genital herpes should talk to their doctor, as genital herpes can be passed on to the baby during childbirth. For many people with the herpes virus, which can go through periods of being dormant, attacks or outbreaks can be brought on by the following conditions. General illness, from mild illnesses to serious conditions. Fatigue. Physical or emotional stress. Immunosuppression due to AIDS or such medications as chemotherapy or steroids. Trauma to the affected area, including sexual activity. Menstruation. What are the symptoms of herpes simplex? Symptoms of herpes simplex virus typically appear as a blister or as multiple blisters on or around affected areas, usually the mouth, genitals, or rectum. The blisters break, leaving tender sores. How is herpes simplex diagnosed? Often, the appearance of herpes simplex virus is typical and no testing is needed to confirm the diagnosis. If a healthcare provider is uncertain, herpes simplex can be diagnosed with lab tests, including DNA, or PCR, tests and virus cultures.